wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's not really nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911. Honey? Tim! Tim, look at me, Gracie. Tell them to hurry. Tim, look at me. Look at me, Tim. I think he's having a stroke.
Discussion will be about why should you care about stroke, risk factors for stroke. When a stroke occurs, what do you do? Can I prevent a stroke? Where can I learn more? Stroke occurs when an artery to the brain becomes blocked or ruptures, resulting in a death of an area of brain tissue due to loss of its blood supply and causing sudden symptoms. Most strokes are ischemic, but some are hemorrhagic. Transient ischemic attacks resemble ischemic strokes except that no permanent brain damage occurs and the symptoms typically resolve within 1 hour. Symptoms occur suddenly and can include muscle weakness, paralysis, abnormal or lost sensation on one side of the body, difficulty speaking, confusion, problems with vision, dizziness, loss of balance and coordination, and in one type, a sudden severe headache. Diagnosis is based mainly on symptoms, but imaging and blood tests are also done. Recovery after a stroke depends on many factors such as the location and amount of damage, the person's age, and the presence of other disorders. Controlling high blood pressure, high cholesterol level, and high blood sugar levels and not smoking help prevent strokes. Treatment may include drugs to make blood less likely to clot or break up clots and sometimes surgery. A stroke is a disorder because it affects the brain and the blood vessels that supply blood to the brain. Blood is supplied to the brain through two pairs of large arteries: internal carotid arteries, which carry blood from the heart along the front of the neck, vertebral arteries, which carry blood from the heart along the back of the neck. The large arteries that supply the brain are blocked. Some people have no symptoms or have only a small stroke, but others with the same sort of blockage have a massive ischemic stroke. Why? Part of the explanation is collateral arteries. Collateral arteries run between other arteries, providing extra connections. These arteries include the circle of Willis and connections between the arteries that branch off from the circle. Some people are born with large collateral arteries, which can protect from strokes. Then one artery is blocked, blood flows continues through a collateral artery, sometimes preventing a stroke. Other people are born with small collateral arteries. Small collateral arteries may be unable to pass enough blood to the affected area, so a stroke results. The body can also protect itself against strokes by growing new arteries. When blockage develops slowly and gradually, new arteries may grow in time to keep the affected area of the brain supplied with blood and thus prevent a stroke. If a stroke has already occurred, growing new arteries can help prevent a second stroke, but cannot reverse damage that has been done. product, GTS, will be the number one solution for a stroke. It involves two special substances that work together to make sure it reduces the damage of neural cells affected by a stroke, as well as preventing blood clot. The term GTS is abbreviated for ginger turmeric shot. The ginger helps by reducing cholesterol and improving blood circulation. It functions as a tonic and gives strength to heart, and this improves the health of stroke patients. Ginger does not let the blood clot excessively, which helps in curing stroke. The turmeric helps by regenerating blood cells, which helps in curing stroke. This compound helps in repairing damage caused by stroke. My team and I have figured out a way of combining two of the substances to make the special cure. Do not take GTS if you have had serious allergy or skin reaction to it. This can happen with GTS and can be life-threatening. Stop taking GTS and get medical help right away if you develop swelling of the face, mouth, throat, or neck, trouble breathing, rash with peeling skin, or blisters in your mouth. Using caution when driving or operating machinery until you know how GTS affects you. Decrease the amount of alcohol you drink while taking GTS until you know if GTS affects your ability to tolerate alcohol. The most common side effects of GTS include nausea, sleep problems, trouble sleeping, vivid, unusual, or strange dreams, constipation, gas, and vomiting. If you have side effects that bother you or don't go away, tell your healthcare provider now.